Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Classification of angina pectoris. Okay, angina pectoris is of mainly three types. First, we have classical angina pectoris. So, classical angina is also is actually a typical type of angina, and it is most commonly located in substernal in location, and the pain is seen as a pressure type of pain is seen in classical angina, and it is seen for a duration of 3 to 15 minutes in size, and it is most commonly provoked by exercise, or it is provoked by emotional issues, and it is relieved by nitroglycerin, or it is relieved by nest. So this is classical angina. So in this, sorry, or rest, it is relieved by nitroglycerin or rest. Okay, in this classical angina we can say that, here, in classical angina there are three types, three important symptoms. So typical location, that is substernal location, pressure type of pain, duration were given 1 point, and second criteria is provoked by exercise, and third criteria is relieved by nitroglycerin or by rest. If all the three out of three are present, then it is classical angina. But we have atypical type of angina. In atypical type of angina, two two of three and classical angina characteristics are present in atypical angina. Then we have non-anginal pain. In non-anginal pain, there can be one or zero of these three characters. Among these three characters, if one or zero are of these characters are present, then we call it as non-anginal pain.
thank you and thank you for watching.